is an honor and a privilege for me to stand before you today as we gather for this important milestone in Botswana's drive towards universal health coverage. We are gathered here to validate today the National Health Insurance Policy, which is one of our government's key health sector's flagship reforms. The National Health Insurance Policy underscores our shared national resolve to uplift the health and well-being of every Motswana. Ladies and gentlemen, healthcare is no mere service. It is the bedrock of dignity, equity, and our nation's progress. Yet honesty demands that we confront harsh truths. Across Botswana, too many of our people still face barriers in accessing healthcare. We are aware that many of our people still wait long times before they can be seen by medical specialists. And not so long ago, many have had to travel long distances to seek medical care, only to find that vital medicines were absent. We are aware that our dedicated and devoted health workers work under difficult conditions with very few available resources at their disposal. Worse still, they are often overstretched due to staff shortages across all our facilities. Director of Ceremonies, these are not just mere anecdotes. They are the daily struggles of Botswana. I want to take this opportunity to assure all of you that government has started acting on all these struggles of our time. The introduction of the National Health Insurance is one of the major initiatives that will change the shape, look, and feel of our health sector forever. Our position as the new government is that healthcare is not just a service. It is a fundamental pillar of dignity, equity, and national development. It is a right that all our people should enjoy. It is our position that every Motswana, regardless of income, employment status, or location, must have access to quality, affordable healthcare without facing any financial hardship. This is what we mean when we speak about universal health coverage. Distinguished guests, ladies and gentlemen, we acknowledge that over the years, Botswana has made commendable progress in some of the following: strong public health investment, expansion of healthcare services, significant achievements in the areas of HIV/AIDS response. But however, we also acknowledge that despite these efforts, access remains uneven, financing is fragmented, and inequalities still persist between those with medical aids and those without, who are the majority. This is the challenge that we must now confront decisively and collectively. Ladies and gentlemen, the introduction of the National Health Insurance represents a bold and necessary step in addressing these challenges. This is because the NHI is not simply a financing mechanism. It is a national commitment. It is a unifying system. And most importantly, it is a reform that will drive transformation, like I said, across the entire health sector. Through the NHI, the government seeks to pool resources nationally and ensure fairness and solidarity, introduce cross-subsidization where those with greater means of support, those with less, improve efficiency and accountability in how healthcare services are financed and delivered, which is a very important one among these, and to leverage both public and private sector capacity and to ensure that no Motswana is left behind. The NHI will therefore act as a catalyst and a reform that compels the entire health system to improve, and it will force us to modernize how healthcare services are delivered, expand and upgrade our infrastructure, strengthen our health workforce, improve supply chains and ensure consistent availability of medicines, and enhance government accountability and our data systems. In this way, NHI becomes the engine that drives a stronger, more responsive, and more equitable health system. Today's workshop, therefore, is not the beginning. It is the result of a deliberate and consultative journey Over the past months, the Ministry of Health has undertaken technical studies and the policy development, engaged with stakeholders across sectors, drawn lessons from international experiences, and carefully considered the unique context of Botswana. As a result, a draft national health insurance policy was produced, which will be discussed here for your appreciation and validation. Ladies and gentlemen, this workshop is a critical step in the NHI journey. It is here that we collectively review and refine the draft policy and to ensure that it is practical, it is inclusive, and most importantly, that it is implementable. We should ensure that it is aligned with the aspirations of our people and our national vision. The workshop offers all stakeholders an opportunity to strengthen the policy through your insights. It is an opportunity to ensure that this reform truly reflects the needs of Botswana. The validated policy will therefore inform the development of the NHI bill, which government intends to table before Parliament. Distinguished guests, ladies and gentlemen, as government, we are clear that this reform must be inclusive. We are fully cognizant of the fact that the NHI will affect citizens and patients, healthcare workers, private sector providers, medical aid schemes, employers and employees, and all communities across the country. Therefore, your voices really matter. That is why when I started, I said, it gladdens my heart to see so many people in this room today, because your perspectives matter. Your participation today will ensure that we build a system that is not only technically sound, but socially legitimate and nationally owned. Ladies and gentlemen, allow me to remind you once more that we stand at a defining moment. The decisions we take now will shape the future of healthcare in Botswana for generations to come. We therefore have an opportunity to reduce inequality, strengthen our health system, protect our people from financial hardships, and to build a healthier and more productive nation. I urge you all to grab that opportunity with both hands and use it. In closing, Director of Ceremonies, allow me to reaffirm our government's commitment to reforming the health sector of this country so that it becomes a health system that works for all its people. I therefore invite you to engage frankly and constructively. Together, let us move Botswana closer to the realization of a universal health coverage as we envisioned. Because it is possible, we believe it is possible, and it can be achieved. I will not be doing justice to you all if I ended without just sharing about some of the developments that have been going on in the healthcare space and how you intend to use some of those developments to complement the NHI. You'll all agree with me that for the NHI to succeed, we need to embark on a multidimensional approach of dealing with other certain departments and ministries that will feed into the NHI. For the NHI to succeed, we need to work closely with the Ministry of Local Government and Traditional Affairs, as they are now in charge of our primary healthcare services implementation. So it is going to be very important that they play a part as a stakeholder. The Ministry of Finance is also going to be very important in modeling and helping us shape this NHI model in terms of financing. We already know, as the Ministry of Health, we have the vision of where we want to go, but we have to work on the infrastructure that we have. We have to work on the digitalization, and you'll be happy to learn that processes are already at an advanced stage to deal with all these challenges, because we appreciated earlier on that an NHI on paper will not do us any good if the other attendant pieces of the puzzle are not taken care of. So issues of staff welfare are going to be very important. We are going to have to deal with that. Government hospitals and facilities are going to start billing. We're going to have to work out how that billing is going to look like. So this is truly a moment in time that all of us can contribute and shape this NHI product. So that is what builds the excitement. And I met with the stakeholders from Bidpa area this week to get feedback from what they have been doing, and I was quite impressed with the work that has gone on into this. From the get-go to the end of the presentation, they were speaking to the heartstrings of the NHI as we envision it. Where is the Bidpa group? Dr. Polo Holo, and there they are, yes. So I'm very happy about the work that has gone into this. But the consultations must not stop. They cannot stop until even the furthest person in the outskirts of Botswana understands what the NHI is about. That is when we'll know we have really done our work. When the people in the furthest end can tell you what the NHI is and what it seeks to achieve. So the consultations must continue. We must keep on with the education, and we must build a product that we can all be proud of in the end. Having said that, thank you so much again for coming here. I now officially declare this gathering open.